Hello guys, Dr. Venkata Krishnan here. Today we will see one of the most important question that's been previously asked in NEET MDS examinations. So the question is all about the face mask, which is also known as the reversible headgear, and you must be knowing that is an extraoral orthopedic appliance to get the maxilla forward. So here goes the question. What's the angulation of extraoral elastics to the occlusal plane that is connected from face mask to intraoral appliance? So before answering that question, let us get to know the ideology behind the extraoral elastics and its attachment from the appliance to the maxilla, right? So if you see carefully, so this is how the face mask would look like for an individual who would require the protraction of maxilla. Alright, so this is the some example of petit face mask I have taken, and you must be knowing Delaire, Tubinger, Petit Grumman's are the types of reversible headgear or face mask that is available. Right, so now face masks are used for the people who are having class 3 skeletal malocclusion because of deficient maxilla, meaning in class 3 malocclusion, the maxilla is posteriorly positioned, which would otherwise require the protraction of the maxilla. Fine. So in this case, we'll be having a face mask which is having an forehead and chin anchorage, and it will pull the maxilla with the help of an elastic. So this is the extraoral elastics, right? Alright. Now, the question is, what should be the angulation of this elastics to the occlusal plane? Okay. So the idea of protraction of maxilla should not be only the anterior protraction, but also the maxilla has to be pulled little downward as well. Because, just pay attention, when the maxilla is being pulled forward, yes, the class 3 gets corrected, but what happens to the mandible? But let us consider another scenario. When we pull the maxilla forward and little downward, what happens? The mandible teeth experiences a downward force. Okay, mandible experiences downward force, and that will cause downward and backward rotation of the mandible, or rather clockwise rotation of mandible. Okay, clockwise rotation of the mandible. So imagine for a class 3 patient whom experiencing a backward and downward rotation of mandible, that would definitely improve the facial appearance of the class 3. Okay. Just because this to happen, the mandible has to rotate the clockwise direction, the maxilla has to pull the downward. And also number 2 point is, patients who are having class 3 will be having deficient vertical dimension as well. Their anterior facial height will be reduced because of the chin prominence. So to improve that as well, imagine when the mandible rotates downward and backward, the anterior facial height also increases. So these two reasons are backing the reason behind the angulation of extraoral elastics, and also the reason to pull the maxilla not only anteriorly but also downward. So coming to the question, what should be the angulation? So according to Dr. William Prophet, he suggests the angulation of 15 to 30 degree of the elastics to the occlusal plane would be optimum to pull the maxilla not only forward but also downward, so that the clockwise rotation of mandible can be achieved. Guys, so I hope this crisp session was very useful regarding the angulation of extraoral elastics to the face mask and intraoral appliance of the maxilla. And yes, we will see in the next session. Until then, bye. Jai Hind. The extra